Good morning, everyone, and sorry for the delay in starting. We had a little bit of a technical glitch on this end, so our apologies for that. We're so delighted that you'll be joining us today. I'm Amanda Reddy, Executive Director of the National Center for Healthy Housing, and it is my sincere pleasure to welcome you to today's webinar, Bridging Silos, Local Environmental Health Collaborations Leading to Primary Prevention. Today, we're going to be talking about collaboration, and I mean real collaboration that breaks down silos and achieves results that are meaningful for a community. People like to say that public health is a team sport, but like all team sports, winning takes a lot of practice, coordination, and planning. And what better time to talk about how to achieve all of that than during Healthy Homes Month? To guide us through today's discussion, I'm pleased to introduce our featured speaker, Dr. Katrina Korfmacher. Dr. Korfmacher is not only a favorite person and colleague and longtime partner to the National Center for Healthy Housing. She's also Associate Professor of Environmental Medicine and Director of the Community Engagement Corps at the University of Rochester. She is also author of Bridging Silos, Collaborating for Environmental Health and Justice in Urban Communities, and that's going to be the focus of today's webinar. During today's webinar, Dr. Korfmacher will highlight ways that communities can collaborate across systems and sectors to address environmental health disparities. She's going to share 3 case studies with us today, bringing us stories from 3 different locations, tackling 3 different environmental health issues. One of them, a case study on childhood lead poisoning in Rochester, New York, will have obvious relevance to your healthy housing work. I'll also note that although you may be very familiar with Rochester's nationally recognized lead poisoning work, the story behind it, how it came to pass, is equally impressive, and you may not know all of those details. The other 2 case studies aren't about healthy housing or lead poisoning at all, and you may be wondering why the National Center for Healthy Housing during Healthy Homes Month is hosting a webinar featuring them. But these case studies have really powerful lessons learned that our community, the healthy housing field, can learn from and build on. We hope that you'll have lots of questions and comments to share during today's webinar, and we encourage you to enter those into either the chat or question and answer box in the control panel on the right side of your screen. We know that many of us are still working from home these days, and as much as we'd love to meet all of your pets and children and housemates, we're going to have everyone muted today in listen-only mode for today's presentation. So please enter your questions and comments into either the chat or the Q&A box, and we'll get to as many of them as we can during today's webinar. And then we'll follow up after the webinar to answer any questions that we didn't get to today. Finally, we've put a link in the chat about how you can join us later this month for a Healthy Homes Month Twitter chat so that you can share your own stories of collaboration. It's also a great way to meet some new partners and start some new collaborations. And with that, I'll turn it over to Dr. Korfmacher.
Thank you so much, Amanda, for the kind introduction, and also to the National Center for Healthy Housing for letting me join them in celebrating Healthy Homes Month. It's really an honor to be with you today. And I also appreciate your indulgence in hearing some stories that aren't specifically about housing, because I've learned a lot from them, and I want to share some of those lessons learned with you. I think of healthy housing as a systems problem, and there are lots of other areas and topics where people have worked together to address environmental justice problems through systems change, through really innovative local collaborations. And I think we can all agree that action at the local level is really important now in the times that we find ourselves. So I'm going to be talking about local environmental health collaborations that lead to primary prevention, which surely is a key theme for our work in healthy housing. But I'm going to start with a broader question, which is how can we promote healthy environments when we manage health and environment separately? Now, this is really clear when you're thinking about lead poisoning prevention, right? That we all know that you can't prevent lead, that primary prevention of lead in the environment is essential, but that can't be done successfully and implemented without engaging health. So I'm going to spend about 5 minutes talking about these 3 points in red, which you could think of as sort of the conceptual and historical framework for this whole book. And then the rest of the time talking about this last point with the case studies, as Amanda mentioned. And I'm going to try to do that as quickly as I can while giving you enough detail that we can really dig in and have a good discussion discussion afterwards about some of the key themes. So as Amanda mentioned, I've written this book called Bridging Silos, and I don't mind promoting it a little bit because it's free. So fortunately, MIT Press got a grant so that it was made open access, and it's a little tricky to find on their website. So I wanted to highlight for you a way to download it for free if you want to hear more details about any of these case studies. This book came from working with colleagues all around the country and learning about their local collaborations to address different issues of environmental injustice. Some of them had to do with housing, others with air, hazardous waste, water, all different topics. But many of them had worked together with community groups, academics, governments, non-governmental organizations to successfully change policies, systems, and ultimately environments to protect public health. But because they're in different areas and different topics, there were few opportunities to share lessons learned across these different issues. So I wanted to take a step back and do that by going in depth in 3 different case studies and ask the question, what can we learn from these local initiatives and innovation about how we can more systematically support such local work on other topics and in other areas? So I start the book talking about Hurricane Katrina, and lots of books and lots of articles have been written about Hurricane Katrina and its aftermath in the city of New Orleans. But since I can't go to that city anymore without my name being taken in vain, I figured I had a license to start my book with that as well. I used to have a quote pinned over my desk from a newspaper heading right after Hurricane Katrina that said, "Katrina has made it clear who the government works for and who it does not." I think everyone across the country recognized in the aftermath of the hurricane and the nature of the governmental response that certain communities were really left out and disadvantaged. But as the country processed it, I think it was the first time that there was widespread recognition that it wasn't just the response to that hurricane, but the vulnerabilities of low-income communities and communities of color had accumulated through hundreds and hundreds of individual decisions about land use, about education, about resource distribution that left certain communities far more vulnerable to this hazard than others. So really this was a systems problem and went back to the roots of managing the environment and public health separately. So I start with this graphic, which hopefully many of you recognize as the Broad Street pump. So every public health class starts with the example of John Snow and the cholera epidemic in London in the mid-1800s, and him mapping the cholera cases and realizing they were clustered around this one pump. The water was contaminated with cholera, even though they didn't realize that's how it was working. He recommended taking the handle off. When that happened, the epidemic receded. So that's sort of our foundational myth, right? But the point that I want to remind you of is that that shows that public health and environmental protection were the same thing when they first started. But over time, as we developed systems for dealing with both of those things, our management systems grew up in 2 separate silos. So you might think of one on the left as health, vaccinations, public health surveillance, education, focusing on health issues. And the one on the right, environment. So we got very good at wastewater systems and drinking water treatment and engineering solutions and technical standards for protecting the environment with the purpose of protecting health. But those 2 management systems really are not integrated. And as a result of many, many decisions being made separately like that, we've not been able to overcome the discrimination and disparities that we see among communities that add up to this widespread headline that your zip code might determine how long you live, and the difference could be decades, right? The public health recognizes that the accumulation of decisions that aren't directly focusing on health have resulted in these health disparities. Now, not for nothing, this is a lot of thought has been given to this and recognized in global health area. I have on the right a graphic from the WHO talking about all the different environmental influences that impact health. So I would say that there's pretty widespread recognition in the public health community that the environment impacts health. but within public health itself, we don't have the tools to address that directly. So I took a step back and I thought about my original professional background, which was in ecosystem management, and the kinds of lessons that we might be able to learn from work that was done in ecosystem management and applying it to problems of local environmental health in urban contexts. So one of the disadvantages of moving from ecosystem management to environmental health is you don't get to show pictures of charismatic megafauna too often, so here's my chance. In the 1990s, it was widely and increasingly recognized by environmentalists that the 1970s major environmental legislation that had passed had vastly improved the environment, but progress was not fast enough and it was insufficient to protect whole systems. So it's kind of common sense that if you want to protect the bison, you also need to protect the vegetation that they're eating, the water that they rely on, the air, the land that they live on. And environmentalists realized that they really needed to work together with communities, with multidisciplinary scientists at broad geographic scales in order to address these problems. So they developed a whole series of collaborative structures to help facilitate that collaboration between different sectors and different issues in order to manage ecosystems as a whole. And as a big picture argument, I'd say we need to think that way about public health. So that brings us to this fourth point, the idea that local collaborations can help bridge those silos and improve management systems to promote environmental health equity, essentially by treating these problems as we do thinking about ecosystems. So to explore that issue and those ideas a little more, I chose 3 case studies to really dig into in depth. And I did that because of my work here in Rochester, New York, right? I've been focusing on this one city and its community's approach to lead in great depth for quite a while, trying to learn lessons that will apply to other areas and learn lessons from other areas and bring them back. And from that, I realized that the devil is in the details, right? You really need to go in depth to understand the dynamics of what makes collaboration work in some places and not in others. So I chose 2 other case studies to kind of complement that. One in Duluth, Minnesota, focusing on promoting a healthy and fair built environment, and particularly around the issues of food access and equitable transportation. And then looking at the ports of Los Angeles and Long Beach and a project called The Impact Project, Trade, Health, and Environment, which was trying to reframe goods movement decisions as an issue of health equity and environmental justice. So that's at a much larger scale, but with a relatively small infrastructure group looking at a really big set of issues. Now, in order to compare these 3 really diverse case studies, I came up with a framework, again, adapted from collaborative ecosystem management, to think about how each of these efforts unfolded. And the first is to think about who was involved, who were the collaborators, the general categories being academic researchers, community groups, government, and the private sector, and asking questions about whether and how that effort brought new people into the issue in new ways. The second is how, and I'd say that there are 3 aspects to that. The first is issue framing. How do you define the problem? What is its scope and scale? The classic example that I learned from Rochester was reframing lead from a health problem to a housing problem, and how powerful that reframing was. It's the resources that people use, and people usually focus on money and how much financial backing you have, but the resources that a collaboration needs can actually come from its human participants, from knowledge, and from finances. So I like to talk about those separately. And then the third is the structures and the processes. How did the group organize itself? How did it make decisions? What was the infrastructure for keeping this collaboration going? And then finally, what? So many of us have worked with logic models and thinking about the outputs and things that we produce, and then the outcomes. What kinds of impacts do those have? Because these collaborations, such a key part is the relationships that they develop between the members and the capacity of the member groups. I also focus on social outcomes as a separate bucket before as an intermediary to thinking about the impacts on policies, systems, and environments. So you'll hear this framework reflected throughout each of the case studies that I'm going to briefly share with you now. So as Amanda mentioned, many of you have heard about Rochester, New York. If you haven't, what you need to know is that the housing is really, really old. Therefore, most of it contains lead. Some of it is in beautiful condition. Much of it is not. And as a result of that, there are widespread lead exposures, particularly for children living in lower income neighborhoods. And so flash back to 2002, here's a map of the city of Rochester, which when I usually show it to people from Rochester, they usually think that it's a map of poverty rates in the city, but it's actually a map of what the lead poisoning rates were back at that time. So this issue was highlighted by an elementary school principal who did a study in partnership with the health department and found that 41% of the kids coming into his school had elevated blood lead levels, and trying to figure out what he could do about that. So this principal, Ralph Spezio, started asking everybody he could think of about this problem. What is lead? Where does it come from? What does it do to kids? And how can we prevent it? And out of his bringing people together and asking those questions with the interest of his students' learning in mind, the Coalition to Prevent Lead Poisoning formed. And it formed in recognition of the fact that while lead poisoning throughout the country had declined significantly, our lead poisoning rate at that time was 10 times the national rate. We had a very strong secondary prevention program through our local health department, but the coalition quickly recognized that the main driver of the problem here was older private rental housing in poor condition. So they really wanted to focus on addressing that cause. And recognized also that in order to do so, they really needed to change the systems from focusing on this within a health system to overall housing, looking at housing conditions. So the first thing that they did was to work to reframe this problem in the minds of experts, leaders, and the community as a health problem with a housing solution. And there was a very sophisticated communications campaign directed directly at members of the public, at neighborhood groups, and at community leaders. And that effort culminated in 2004 with a community-led summit with national experts, including from the National Center, from CDC, from many other organizations, and drew 500 people to focus on this issue. With the energy coming, so the other thing I wanted to mention is that the coalition, one of its key resources was knowledge. So it did have scientists and from the local community and also nationally who helped inform its efforts. It did a little bit of local research, mostly in a demonstration mode in the Get the Lead Out project, where they assessed about 100 homes to look for lead hazards, and used that knowledge to inform a local lead law that was passed in 2005 and implemented in 2006. And as many of you know, that requires proactive lead inspection of all pre-1978 units every 3 or 6 years, depending on the size of the housing and its lead history. And the most recent information is that as of June 2019, over 180,000 inspections were completed. And overall, this has contributed to elevated blood lead levels in Monroe County going down 2.5 times faster than in the rest of upstate New York. I also want to highlight that this coalition is a success story that Rochester is really proud of. So it has served its decision-making, its community process has informed many other local initiatives having to do with, for example, obesity prevention, high blood pressure, lots of other issues that have nothing to do with housing, and that the coalition has sustained over time to help support implementation of the lead system. They've looked very closely evaluating it for its successes and gaps and ways to make it better, and have put increasing amounts of energy into trying to advise and help other cities and to take the lessons learned locally to inform state and federal programs. I'm going to transition to our next case study, which is in a very different, in some ways very different, some ways similar community, also Great Lakes city with a history of industrialization, Duluth, Minnesota, which is on the far western edge of Lake Superior. I like to start with a couple of pictures of Duluth because it's very well known for its trail system and outdoor amenities. The picture on the right was taken in the middle of March when I went to visit in the middle of a snowstorm, and I thought I saw a seal in the middle of the lake. And then I thought, wait a minute, there are no seals in fresh water. It was a surfer. So these are intrepid people who love their outdoors, and that's been one of the hubs and drivers of redevelopment of the city of Duluth, having been an industrialized city that lost all of its industry by the 1980s, and at that time had the highest unemployment rate in the entire country. But since then, this recreation interest, health, and other sectors have started improving the Duluth economy, but local stakeholders recognize that that tide is not lifting all boats, that there are lower income communities that were not benefiting from this redevelopment, where there were significant health disparities. So that recognition led to Healthy Duluth, which is really multiple streams of action, not a single organization or effort, involving multiple agencies and non-governmental organizations, and over time really evolving the focus of those organizations and the community in general on promoting health equity as it redevelops. So the overall efforts that I'm talking about focused on healthy built environment, starting with, and I'm going to tell you briefly about each of these efforts in turns. Fit City Duluth, the Healthy Duluth Area Coalition, a series of health impact assessments, some Brownfields redevelopment work, and overall efforts to promote transportation equity. So this story goes back to when the governor of Minnesota established a program where cities could voluntarily opt in to be fit cities, and Duluth signed up because of its its strong emphasis on outdoor recreation and trails, and that group started within City Hall, but very quickly realized that in order to make it impact, they needed to change policies. So they transitioned out of government into a nonprofit that started learning from other communities. For example, by being selected as one of CDC's pioneering healthy communities and being invited to bring a group of 10 people from Duluth to a conference where they learned about the systems change efforts going on elsewhere. They saw this Unnatural Causes DVD, which hopefully many of you have seen. If not, I recommend it just because the health department in Duluth talks about watching this video as having a huge impact on the way they thought about their work and transforming and transitioning to thinking about how could they promote systems change. So Fit City soon evolved into the Healthy Duluth Area Coalition, which was hosted by a non-governmental organization called the Zeitgeist Center for Arts and Culture. It has a very broad mission, so taking on promotion of community wellness was a good fit for them. This let them bring together multiple different community agencies and provided a forum for coordinating different campaigns, particularly around fair food access and active transportation. Meanwhile, the state of Minnesota has gotten very interested in health impact assessment, and with funding from CDC and from the Health Impact Project of Pew and the Robert Wood Johnson Foundation, was able to do 3 health impact assessments in collaboration between local stakeholders and the Minnesota Department of Health. The first one was around a street redesign on 6th Avenue. There's a picture of 6th Avenue there on the left. The second one was on Lincoln Park, which is a lower income neighborhood just west of downtown. And the third was on Gary New Duluth, which was a community far west of the city that had been built as worker housing and almost entirely had experienced a lot of vacancy with the loss of industry. So participating in these health impact assessments really built up the capacity and understanding of local groups and residents about how the environment impacts health, and gave them tools to look at issues going forward. There was also a lot of brownfield redevelopment activity in Duluth, and I want to highlight this particularly because of US EPA's role in inspiring them to focus on health. Because the US EPA's brownfield applications give points for applications that can show an impact on public health, that inspired the people in Duluth writing those applications to learn about health and how their work could most effectively promote health equity. So there have been a lot of efforts in Duluth, because the city is essentially all brownfields. It has the largest Superfund site in the country, and many acres of potentially contaminated land that, as the economy has been growing, there's more and more incentive and pressure to redevelop them. The final area of work in Duluth was around transportation equity. So I mentioned this community has a really strong network of bike trails and a lot of passion for using them. But as they did this built environment and health equity work, realized that these trails and the ability for people to get places was the most important thing. So for example, the city decided to prioritize its bike trail planning and construction resources to low-income neighborhoods that were identified through those health impact assessments. They also realized that there was a food desert in this relatively small area, and it wasn't feasible to have another grocery store built, but they could get a dedicated bus that would help get people from lower income neighborhoods directly to that food store. In order to keep the community awareness of these efforts up, they practiced tactical urbanism, occasionally setting up, taking over parking spaces and doing really visible ways of reimagining the urban environment, and then consistently participating in street redesign projects to promote the idea of complete streets and making it more possible to have active transportation. Also, all of this work helped the Metropolitan Planning Organization realize that they needed public health representation to make sure that voice was heard in the course of all of their decisions. So I hope I've given you a sense of there were lots of different things going on in Duluth in many different sectors, and that worked its way up to the top. So when a new mayor was elected in 2016, Emily Larson, she announced in her first State of the City address that our right to good and healthy life should not be determined by our zip code, our income, race, gender, or religion. My vision is of a healthy, prosperous, sustainable, fair, and inclusive community. And for that time, that was a pretty surprising thing to hear from a small city mayor. And she directed the city to include health and fairness as goals of the comprehensive plan revision. So the Healthy Duluth Area Coalition has also gotten funding for a health equity collaborative. They've integrated into the efforts for community health needs assessment, effort called Bridging Health Duluth. And their overall efforts have been recognized by state and national organizations. So I wouldn't say that they have a system for considering health in all policies, but this idea is so infused in everything that they do now that, that they've made a lot of progress. So the last case study is the ports of Los Angeles and Long Beach, California, which you may know is the location where 40% of the goods imported to this country from China come in on these giant ships in containers that get transferred to trains and taken to warehouses and then put on trucks and distributed throughout the country. And so at the bottom, you can see where the port is. The pink line is the highway going up towards where the warehouses are. And each of those kinds of transportation hubs affect different communities throughout this region. But they weren't being considered as a whole. Until 2001, the University of Southern California hosted a town hall meeting and to try to identify what were key issues of environmental health and justice in the region. And community groups who came to that said goods movement activities are a key health issue for our communities, particularly focusing on air quality for people living close to ports, rail yards, and roads. And because this growth, the goods movement industry was expected to continue growing, they've decided it was really important to think of this as an overall system. As before, the ports were seen primarily as the economic engine of the region, but not as a source, not as a health issue. So the work of the Impact Project was to try to reframe ports and goods movement as a regional issue of environmental health and justice. So they organized themselves somewhat differently than the other groups. They were administered through the University of Southern California's Environmental Health Sciences Center, which has a community outreach and engagement core that could write grants and administer them and host them. But this partnership that developed over some very intentional work for several years among community groups that were doing environmental justice work related to the ports and academics who were studying the effects of air pollution on children's health particularly, came together to say, let's look at this as a whole system, not as individual issues in individual places, and formed the Impact Project, again, standing for Trade, Health, and Environment, with 4 local environmental justice groups, 2 academic partners, and they equitably divided up the grant funding that they received, the decisions that they made, and even rotated their meetings from location to location. So here are the 4 environmental justice groups that were members of the Impact Project. And as you can see, they were located pretty far apart throughout this region. This project is still active today and has produced a vast amount of material and different kinds of outputs. I just want to highlight some of the more innovative ones. They had a project of developing neighborhood assessment teams to involve local residents in monitoring pollution and counting trucks in their neighborhoods. And not only did that provide data, but more importantly, it helped those residents understand the issues and become effective voices to testify, to talk to media, to organize their neighbors in decision and policy contexts. So they brought them together. They also produced digital stories as a way of sharing what they learned in a very accessible way. They also produced a number of policy briefs for different audiences to help dig into these issues and summarize the research in a way that was meaningful to community leaders and decision makers. They also brought together what were called the Moving Forward Together conferences, recognizing that these weren't the only port communities facing similar issues, and they were all hungry to learn from each other. So this work was going on in Los Angeles and Long Beach, but fairly early on started reaching out to other groups dealing with similar local issues in different communities. So one of the big outcomes of this project has been to build the partners' capacity to act on their own. So it was a fairly loose structure, just 6 groups working together and to collaborate, but mostly to develop the capacity of each of those members to work separately, but yet in a coordinated way in a wide range of different decision settings. So some examples are, have been some very significant proposals for expansion of goods movement infrastructure, including a big rail yard called BNSF SCIG, the Southern California International Gateway, and longstanding efforts to expand the I-710 freeway. And these groups, through developing their capacity in the Impact Project, were able to effectively comment on the environmental impact review. They supported health impact assessment. They joined and educated members of those committees and testified in hearings. And all of that taken together infused the idea of health equity throughout these decision-making processes. As I mentioned, again, this local group has had national impacts, both through reaching out to other local communities and serving on state and federal councils. They've been featured in many news articles, reports, and websites, and spawned this ongoing national network of communities that are in similar situations. So this group can't point to a specific decision that they've changed or blocked or made, but they have reframed this issue and reframed processes, ways of making decisions, for example, by opening them up to public participation in very significant ways. Okay, so that's the end of the case studies. I want to take a couple of minutes now to look back at that framework that I shared with you of how do we compare, what do we learn from these 3 really different case studies. And I'm going to be, so I'm talking about the who, the how, and the what, and how different they were in each of these cases, and yet there were some common themes, right? So in each one, there were ways of accessing technical knowledge, many times through academic partners, but not always. So there were different mixes of academic, community, government, and private sector actors. But interestingly, in each of these cases, the work was initiated by local stakeholders who were outside of the management system. They were not initiated by the governmental agencies that were responsible for managing any of these problems. But once they did, the local governments, the responsible organizations that were already involved in these issues supported them. So I'd say outsiders raised the issue, insiders built the capacity to move things forward. Each one was initiated locally, but there was a lot of interaction with state and national organizations that helped build their capacity, sometimes provided funding, shared new ideas. And in each case, different kinds of groups served as conveners. And I like to highlight this because sometimes we look at an issue and want to move forward and say, okay, we need to form a new nonprofit organization to deal with this. But in each of these cases, a different kind of an organization, a community group, a government group, an academic group was the host, and their roles changed over time. The role of community members and groups was also very different in these groups. They were not grassroots community organizing efforts, but they tried very hard to engage and support the efforts of those groups and build their capacity so that they could be more effective in the future. Sometimes that was direct and sometimes that was indirect. Another point is that there was a wide range of targets for system change. So it wasn't focused on that they wanted to change one specific policy or end one specific development, but really to look overall at how are decisions made and what is the whole set of decisions that are affecting this outcome that we care about. And then finally, that the targets for systems change, so often a governmental organization, was a partner in each of these efforts, but wasn't a leader, wasn't a decision maker. And that's sort of related to the insider-outsider point I made earlier. So a few thoughts about the how. As I mentioned, each one of them fundamentally reframed the issue that they were working on. I didn't realize until I was writing the last chapter of the book that, hey, in each of these cases, the issue they were worried about was already getting better. Air quality in Los Angeles had improved dramatically. The environment in Duluth was, being redeveloped, and lead poisoning in Rochester overall rates had come way down. But the focus on equity and fairness brought a lot of new energy and approaches and solutions to how to address the problem. Another theme, of course, is that they integrated environment and health information and interests in new ways, where you might see, typically data and information being owned by different agencies without a way of bringing them together. Sometimes you even see something as simple as health data being available at a zip code level, but housing data being available at a municipal level, and no easy way to combine them. Each of them obtained human knowledge and financial resources, but in different ways. So they all had some financial resources. None of them had a single large funder over the time, and all of them faced challenges in supporting their convening functions, but they figured out different ways to do it over time, largely by leveraging human resources, by essentially persuading people that this was a good place to invest any discretionary energy they had. So I say they leveraged a lot of human resources, and because those humans had a lot of knowledge, that meant they brought a lot of technical information from multiple disciplines and the credibility of all those diverse partners to their effort. And then finally, and something that I think surprises a lot of people, is that the structure and organization of these efforts was very varied, but most of them were quite informal and temporary. None of them established a new 501c3 with a core mission and bylaws and steady funding. So finally, I've described a variety of outputs of activities from these different efforts, all appropriate to their diverse goals, but noticing that the social outputs, the relationships that were built between the participants, the capacity of the individual groups to act going forward, and the relationships outside of the community supporting dissemination, all those things were really important. And then finally, looking at how they impacted policies, systems, and environments. All of them affected how decisions are made, not just what decisions are made, but how they are, largely in terms of increasing openness and participation. It is really difficult, therefore, to measure their impacts on the environment, never mind health. Now, in the case of Rochester's lead law, we can make a pretty persuasive argument that the overall lead system here has contributed to a more rapid decline in lead levels. But that's pretty unusual because these effects tend to be system-wide, indirect, and long-term. Also, another thing that's hard to capture is that there have been impacts on other communities and national groups of each of these efforts, and that each one has inspired other things going on in their community that have nothing to do with their initial goal. Those are things that aren't captured in a regular, a metrics-driven evaluation. So I wanted to highlight that those are some of the surprising things that we found by looking really in depth at these case studies. So just to sum up, I'd say there are 10 themes that I would take away from this, particularly for healthy housing groups, and I would love to hear your thoughts and questions after this. That health equity is a powerful idea to bring into environmental issues. I think of a transportation planner in Duluth who said, we've been talking about these issues for so long, about complete streets, about making communities more walkable, but when you had the public health numbers there, all of a sudden we had so much more energy and attention from the community. The second is the collaboration is a process, not an organization. You don't need to wait until you have funding and a 501c3 to work together. And going along with that, that many different kinds of groups can serve as this convening function for collaboration. There are lots of different ways to support, engage, and build community partners. One of the things that I hope we'll talk about is how challenging it is in these times when community groups have such limited resources and so many things going on that just staff time to go to meetings, never mind engage residents directly, is really challenging. Another is that boundary spanners are created, not born. So the people who were working outside of their organization with different kinds of sectors, for many of them, it was the first time they had ever done that. And when I asked them about why they did it, they said it's because this finally provided them with an opportunity to accomplish the goals that they wanted to, that they couldn't do just working within their own organization as they had for decades. So as I mentioned before, people who are members of the management system were often members of the group, but didn't have a key decision-making role. Another point, and being in an academic institution, I sort of hesitate to say this, but many of them didn't do research. Research could be helpful. In the case of the Impact Project, it was incredibly powerful that they had nationally leading researchers on the effects of air pollution on children's health there. But what was more important was the ability to translate that knowledge into actionable outcomes and recommendations. I also wanted to highlight that we are all trying to measure and evaluate what we do, and really what we're trying to do is improve health, but sometimes that's really hard to capture. So thinking carefully about whether we are going to look at intermediate environmental variables or health, it turns out to be pretty complicated. When I say locals are listening, I mean that each of these groups was locally initiated, but the people involved were very active in reaching out to people in other communities and in national and state groups to learn from them, to get resources, and to adapt that to address their local problem. So for those who are working at the national level and trying to seed this work, there's some really interesting examples that you might not even ever hear about of how that work was received and integrated and activated at the local level. And then the converse, that local initiatives can have national impacts, that we are able to learn so much from each of these cases that informs the efforts of national organizations and government agencies. And that I think, thinking carefully about how we can do that more effectively is an important thing to think about going forward. So I've left us about 10 minutes for discussion, and I would really welcome hearing any questions or comments that you might have now.
Great. Thank you so much, Katrina, for that really inspiring and practical presentation. I see some questions have been coming in, and so we're going to get to those in a minute. As we're waiting for other people, go ahead and enter your questions in so that we can make sure that we can try and answer them during the time we have left here. I want to remind everybody that we have put links to the Twitter chat later this month where you can tell us about your own success stories around collaboration or meet some new partners. There's a link to that in the chat. There's also a link to Katrina's book, that free download of Katrina's book, and a reminder that a recording of this webinar will be shared with all of you later this week. We got a few questions about that, so that will definitely be made available. We've had lots of people say, I need my colleagues or my partners to hear these stories, so please share that widely. So the first question, Katrina, is to ask you, we had a question come in that said, I work with a statewide coalition. How can we ensure that we hear from community members who are impacted by public health issues? This is challenging when community members are often not organized.
Yeah, and that is a central challenge because you say not organized. I just want to clarify that probably that means that there may not be official organizations that can represent interests, but usually there are intermediate groups that are working directly with people who are affected by the problem that you're concerned about. And I think there is a tendency when we talk about direct community engagement that is so important, but a theme of all this whole project has been really thinking about what individuals' incentives and constraints and needs are. And so, for in the communities that you're talking about, it may be that people are focused on other priorities and don't have the capacity to say, go to a meeting at 7 o'clock. You know, we've all faced that problem before. And I think that what each of these groups did pretty well was to be very sensitive to that and to both tap as much information they could from groups that directly touched the affected communities, and at the same time pouring resources into increasing their capacity to participate more directly in the future. So there may not be community groups organized around, say, this environmental health issue, but there usually is some sort of infrastructure for interacting with people. And you know, that's one of the reasons I say I think that this is a little different looking in rural areas, that you may need to think even more broadly. Even Duluth, for example, the main hub for community organization was an arts and culture group. I think that shows a lot of creativity, if you excuse the pun.
Great. Another question for you, Katrina, and you started, I think, alluding to this in your last answer, but how might the current COVID-19 situation and all the social distancing that's in place affect our ability to collaborate? And are there any lessons learned from these case studies that might shed some insight on that?
Well, I think that you should have a whole other webinar that's all participant based on that, because I think all of us are struggling with that in our communities, but also innovating. So personally here in Rochester, we thought that maybe we should cancel our community meetings because people were so busy dealing with COVID, and we weren't sure about you know, whether they were going to want to be focusing on the things that we were talking about in the healthy home space. But it turned out that those existing organizations, even very informal collaborations, have been really powerful ways of helping people share information and resources that may have nothing to do with healthy housing and may have nothing to do with COVID, but it's so challenging to connect now that that's helpful. Another is that in some cases, people have found that this has actually leveled the playing field and made it easier to collaborate because you don't have as many constraints about physically getting to a location if you're holding meetings remotely. And in others where it's more challenging because people don't have equal access to technology to participate in this. So I think it would be really important as time goes on for us to pool our experience about how that has been in this time and how we can prepare to do it better in the future.
Great. We have a question here asking if you can elaborate on the takeaway that collaboration is a process and not an organization. How does that work?
Yeah, thanks. So I do emphasize that none of these efforts was led by a 501c3 because they were not trying to create a new organization, right? They were trying to solve a problem and shift a system to make themselves obsolete. And it was interesting. There were two things that I heard almost direct quotes from each of these groups independently without being prompted. One was that they were trying to make themselves obsolete. So they were trying to figure out how to coordinate with each other, how to collaborate, but in a way that put as much energy into solving the problem and changing existing systems and as little into creating a new organization and sustaining that where you can have goal slippage, right, as possible. And then the second thing I heard from all of them was that the stars aligned, that the stars just aligned, but we helped them align. So thinking about how different forces are coming together, and that the secret sauce was to show them how their interests were common and were aligned, and providing a new way for them to interact.
Great, thanks, Katrina. Another question that has come in is, that you point out that each of these communities had some resources to start with, but what about communities that don't have any resources?
These are all really great and challenging questions. So to the first point that everyone had some resources, I call it sort of the stone soup of organizing. I really worry about people having a takeaway message from this book that because so many great things happen at the local level, we can leave it all up to the locals. And there's a book that I rely on pretty heavily in the end of this by Scott Cummings called Blue and Green, The Drive for Justice in America's Ports. And he reflects on how focusing doing too much on the local level can exacerbate inequities between communities, where those who have some resource that they can put into a pot and then collect other resources to get action, versus those that can't even start. So I think that what we need to do is learn lessons from the places that have had that ability, and take those lessons and infuse them. We do have state and national management systems, and we should be looking at these local efforts as laboratories for innovation that can be then taken up and diffused by those state and federal organizations, not as the solution. Because if we do that, then those communities that are already disadvantaged are going to fall farther behind.
That's great. The questions are coming in fast and furious now, Katrina, so we may have to, if we don't get to your question today, we will follow up after the webinar. I wonder, Katrina, if you could tell us a little bit about if there are any insights about how, from these case studies or others, about how to sustain these collaborations, over time after you've had that initial success.
That's also a great question, and one that's near and dear to my heart. Here in Rochester, we've had such energy around the effort to pass the lead law, and then it's really robust engagement in implementing it, but sustaining that core convening, especially when there's a perception that the main problem has been solved, is really hard. Funders like to fund the newest, shiniest, brightest thing. Passing a new policy or inventing a new program is much more attractive to a funder who can point to, look at what I created, than sustaining something for the long haul. That is really tricky. But I also wanted to come back again to my earlier point that each of these efforts aim to put itself out of business. And if it's successful in really changing the system in a robust way, maybe that effort itself isn't needed in its original form. Maybe some sort of sustaining watchdog function is enough. I do think that long-term participation and implementation is really difficult, and it is very important. So I do, in the last chapter of the book, offer some ideas about how funders, academics, governments, and community groups can all change slightly to try to sustain those sort of evaluation, implementation, and sustained collaboration functions.
Great. I think we have time for just a couple of more questions here. So if we don't get to your question, we will try to follow up with you after the webinar. Our next question says, I work at a consulting firm that does noise modeling, particularly for airports. Much of the regulatory processes that we are complying with have minimal community engagement in the form of a citizen advisory council, and at times we seem to have an adversarial approach to specific community groups. However, the regs we follow often result in grant money allocation for noise insulation. We also do not connect well with public health. Are there strategies for connecting profit-driven consulting groups more to the healthy housing space?
Wow, I would love to give that one some more thought and get back to you. And first of all, thank you so much for asking that, because I think that is really important, especially as government and community groups have such limited resources. This may sound like a pat answer, but going to what the community interests are and organizations are, and then figuring out how best you can support those with the kinds of constrained and limited resources that you have, even if there's only a little bit of overlap, that can make a big difference. Also finding things that you can work together on that may not be mission critical to what you're trying to accomplish, but establish some sort of a relationship and interaction and trust may lead to some of the more powerful leveraging that you see as a potential along the line, but that may not be the place to start. So I think certainly, going to what people care about and are concerned about, and being clear about what your constraints are, but doing what you can to help is often a very helpful starting point.
Thanks, Katrina. And I see that we're at time. So again, to those of you who didn't get your questions answered, we'll be following up with you individually. We'll also see lots of questions about links to the recording, link to the policy briefs, and other resources that Katrina mentioned. So we'll make those available to everybody. I want to take a moment to thank all of you for taking time out of your Healthy Housing Month to join us for today's webinar, and to Katrina for a really really inspiring presentation. We hope that everybody has a wonderful day.
Thank you all for the work you do, and a happy Healthy Housing Month.